Welcome to Adolescent Dual Diagnosis, Depression and Substance Use, Screening, Care and Integrated Practice. This course has been designed to strengthen your knowledge and practical skills in supporting adolescents who experience both depression and substance use disorders. Over the next 3 CPD hours, we will explore key concepts, screening tools, treatment models, and service pathways to help you provide safe, integrated, and evidence-based care. Who should take this course? This course is intended for healthcare professionals working closely with adolescents. It has been designed for registered and enrolled nurses, mental health nurses, and youth workers. It also supports school nurses and counsellors, general practitioners, and early career psychiatric registrars. Allied health professionals, including psychologists, social workers, and alcohol and other drug workers, will benefit from the content. Additionally, rural and remote health professionals, as well as clinical educators and nursing students, will find the course relevant to their practice. Why this course matters. Adolescents experiencing both depression and substance use present one of the most complex challenges in modern healthcare. Research shows that between 55 and 88% of adolescents with substance use disorders also have a mental illness, with depression being the most common. This relationship is bidirectional. Some young people turn to substances to self-medicate, while for others, substance use worsens or triggers depression. In Australia, dual diagnosis services are fragmented, and many frontline clinicians lack adequate training to address these challenges. This course equips you with practical tools to screen, assess, and support adolescents with co-occurring conditions, bridging the gap between mental health and alcohol and drug services. Module 1. Understanding Dual Diagnosis in Adolescence. In this module, we begin by defining what dual diagnosis means, the co-occurrence of depression and a substance use disorder. We will examine the prevalence of dual diagnosis among Australian adolescents, drawing on data from the Australian Institute of Health and Welfare and state health reports. You will explore why causality is difficult to determine, considering both self-medication and substance-induced depression. Finally, we will look at special risks facing Aboriginal and Torres Strait Islander youth, including intergenerational trauma and higher exposure to risk factors. Module 2. Screening and Assessment Tools. This module introduces the screening and assessment tools that are most effective in identifying dual diagnosis in adolescents. You will learn about the CRAFT 2.1 screening tool for substance use and the PHQA for adolescent depression. We will review how to identify red flags for suicide or self-harm and understand the urgency of acting on these risks. A step-by-step flow will guide you from screening through risk triage to referral. We will also discuss documentation tips that ensure clarity, accuracy, and readiness for audits or clinical reviews. Module 3. Safety Planning and Crisis Response. In this module, we focus on what to do when urgent risks are identified, such as suicide or overdose. You will learn the immediate steps required to keep a young person safe. We will cover how to develop a safety plan with the adolescent and their family, ensuring it is practical and tailored to their needs. You will also learn escalation pathways, including referrals to the emergency department, acute mental health teams, and child protection when required. Key Australian supports and hotlines, such as Lifeline, Kids Helpline, and Headspace, will also be introduced. Module 4. Integrated Treatment Approaches. This module explains why integrated treatment is superior to parallel or sequential approaches. You will explore the Adolescent Community Reinforcement Approach, ACRA, and its evidence base. We will also cover cognitive behavioral therapy, motivational interviewing, and family therapy, all of which are effective in treating dual diagnosis. The role of schools in relapse prevention and recovery will be highlighted. Finally, we will look at how to coordinate across mental health and alcohol and drug teams to provide cohesive support. Module 5, Cultural Safety and Indigenous Youth. In this module, we discuss the importance of cultural safety when supporting Aboriginal and Torres Strait Islander adolescents. You will learn how to provide care that acknowledges intergenerational trauma, cultural identity, and the impact of stigma. We will look at involving Aboriginal health workers and community services in care planning. A case example will demonstrate what a culturally safe referral pathway looks like in practice. Module 6, Service Pathways and Workforce Training in Australia. This module focuses on the service and workforce context in Australia. You will learn about the Victorian Dual Diagnosis Initiative and other models designed to bridge gaps between services. We will explore the reality of navigating fragmented systems, including mental health, AOD, education, and family supports. You will also consider workforce gaps, such as the lack of dual diagnosis training for nurses and frontline staff. Strategies for advocating for further training, supervision, and integrated practice will be provided. Module 7, Clinical Scenarios and Case Discussions. In this final module, you will apply your knowledge to real-world case discussions. Case 1 involves a 16-year-old with depression and binge drinking. Case 2 features a 14-year-old presenting with cannabis use and suicidal ideation. Case 3 introduces an Indigenous youth with trauma, anxiety, and polysubstance use. Through these case studies, you will practice decision-making skills, moving through screening, safety planning, integrated care, and referral pathways. Learning outcomes. By the end of this course, you will be able to explain what dual diagnosis means in adolescents and why it matters. You will be able to confidently screen adolescents using validated tools such as CRAFT and PHQA. You will know how to identify and act on suicide or overdose risk with clear safety planning. You will be equipped to apply integrated treatment models, including ACRA, CBT, motivational interviewing, and family therapy. You will also be able to provide culturally safe care for Indigenous youth and navigate Australian service pathways such as the VDDI and AIHW guidance. CPD Course Assessment. At the end of this course, you will complete an online assessment consisting of 15 multiple-choice questions. These will cover dual diagnosis concepts and epidemiology, screening and safety planning, integrated treatment approaches, and service navigation in Australia. The assessment will also include case-based decision-making to test your ability to apply your learning in practice. Certificate and CPD credit. On successful completion of this course and assessment, you will receive a digital certificate of completion. This certificate confirms 3 CPD hours in adolescent dual diagnosis, depression and substance use. It demonstrates your competence in screening, safety, and integrated care for co-occurring disorders in adolescents, strengthening your professional practice and service delivery.